Today we're looking at minor cuts and stings. I'm sure you've all cut your finger at some point, whether it's a paper cut or with a little knife, or maybe just a nick of your finger. Nothing serious, right? Before you put a plaster on though, it's really important that you actually wash the area thoroughly. Now, if you're at home or in a facility that you've got access to warm soapy water, wash it in the warm soapy water. It gets all of the bacteria, and then just make sure it's dried naturally before you put a plaster on. If you're out and about and you don't have access to warm soapy water, that is when the wipes come in really handy that you will have inside a first aid kit. To use these wipes, very easy, but a couple of things to be mindful of. When you're going to use it, you want to fold it over and you want to wipe away over the top of the injury, turn it over, and then wipe the opposite way. And that will kill all the germs. What a lot of people do is this. And all you're doing is rubbing the dirt in. So again, towards you, turn it over and away. Make sure it's nice and dry. Then you're going to pop on a plaster. Now, depending on your skin type, you may wish to have hypoallergenic plasters if you've got sensitive skin. If you're putting plasters on any young children under the age of 5, it's hypoallergenic plasters. If you're working with food, it has to be blue plasters. So I've got my plaster here. Now, here's a little tip for you. To put it on, you want to squeeze the ends together, like so. And in the middle bit here, this is where the sterilized part is, and you don't want to touch that. Pop the plaster onto where the tiny little grazes or paper cut. Take one side off and fold it, and then the other side and fold it. Job done. We actually advise you to change your plaster every 3 to 4 hours. And people are quite shocked by this when I tell them, but you've got to be mindful. A plaster is for a barrier to stop germs from getting in. However, as soon as you put a plaster on, behind it, it's dark and it's damp. And this is where bacteria loves to grow. If you leave it on for an extended period of time, you're increasing the chance of infection. So after 3 to 4 hours, take it off, reapply a fresh one. When you go to bed at night, take it off, leave it off, let the air get to it. The next day, if you're still working with your hands, it could be doing something dirty and risk of getting dirt inside of it, pop another plaster on purely just for protection. So that's the minor cuts, fingers, paper cuts. Let's have a look now at a splinter. Now, I'm sure you've all had a splinter at some point in your time. Sometimes people just bite it out with their teeth. Now, you can do that to your own finger if you want to, but I strongly advise you not to do that to somebody that you are first aiding. Inside your first aid kit, you will, well, not always, but you may have tweezers. If you do, that's great. All you want to do is grab the end of the splinter and literally just pull it out in the direction it went in. Once you've got the splinter out, squeeze it. You want to get a couple of drops of blood, and that flushes out dust or dirt that went in within. Warm soapy water, give it a clean, and if you require it, put a plaster on top. If you don't have warm soapy water, you are back using your wipes. If you cannot get the splinter out, it's okay. Most of the time, splinters work their own way out. But if it's annoying and you're picking and picking and picking, pop down to your local pharmacy. They have special, what we call splinter pads. It goes onto the finger, or wherever the splinter is, and that will draw it out quicker and get it out of your way and stop that annoyance. Let's have a look then at nettle stings. The funny thing about nettles is, we've all been stung by nettles. I don't think I know anybody that hasn't. So I'm going to put a glove on for this because I really don't want to touch it. So this time of year, there's not too many big ones around, but I've just got a little example to show you. So this one was just taken out of the ground just this morning. Nasty, aren't they? especially in the summertime when you've got on shorts and you'd brush your legs up against it. How are you going to treat a nettle sting? Are you going to get yourself a dock leaf and rub it? No, you are not. The theory was that you use a dock leaf to rub on a nettle sting and they grow next to the nettles for that reason. That's not true. The reason why these dock leaves grow next to nettles is because they both like the same soil. That's why they grow next to each other. So if you ever get stung by a nettle, this is what you need to do. The answer is nothing. Do not touch the area. I know it can be difficult, but do not touch it for 10 minutes. When you look closely at nettle stings, they actually leave tiny little spikes of stingies inside your skin. And if you were to rub it, you're just pushing it in even further. The sting will actually dry out within 10 minutes. And when it's dry, now it will turn to powder. Get a brush, it could be a makeup brush, it could just be maybe a paper towel, and all you want to do is just brush the dust off because it's now powder form. Once you've done that, if it's still stinging, you could quite easily get an instant ice pack or a bag of frozen peas just to put it on to soothe it, to get the heat out of it. If it's extremely irritating you, pop down to the pharmacy and they will probably give you antihistamine. This is extremely good for stings or bites. Speaking of stings, what about bee stings? Now, wasps are nasty because they sting you and then they go and sting somebody else and somebody else and somebody else. But bees die for us. When a bee stings us, the tail is barbed, which means it sticks into the skin and the bee flies away. So we want to make sure that we get the stinger out correctly. Things that you don't want to do. 1 is use your fingers, and 2, you don't want to use tweezers either. The reason for this is at the end of the stinger, there's a little sac of poison. And if you squeeze it, you're actually injecting even more poison in and it's going to sting even more. So very simply, I'm sure you've all got a card, bank card, credit card, debit card, it doesn't matter. What you need to do is gently just push it out, gently just push it out, and that will get the stinger out. Once it's out, if it's sore, it's painful, and it quite probably will be. Again, if you've got an ice pack or a bag of frozen peas, pop it on and that will get the heat out of it. If it's still sore after the ice pack, no problem. Pop down to your pharmacy and tell them, and they will give you some antihistamine, which will relieve the annoyance, should we say, of the sting. I'm Sarah, owner and trainer of First Aid at Work, making training fun, engaging, but most importantly, memorable.